Welcome to a new episode of Science in Context. I'm Sabine, and this week, Olanrewaju Edun joins me to speak about HIV Response beyond 2030. Olanrewaju, 2 meetings were held last year in Boston and Gaborone. Can you explain a bit more?
Thank you, Sabine. And so the global goal to end AIDS as a public health threat, which essentially is a target for all countries to reduce new HIV infections and AIDS-related deaths by 90% between 2010 and 2030, has really motivated remarkable progress in several countries. And many countries in Eastern and Southern Africa are actually on track to meeting these targets. However, the intense focus on meeting these targets have left some ambiguity about the expectations for the HIV response beyond 2030. And to work with the UNAIDS to convene a consultation series to characterize the epidemiological situation in 2030 and beyond, and to define what will be required to sustain epidemic control beyond this point.
And what were the key take-home messages?
So modeling simulations consistently projected that if current levels of HIV interventions are sustained, new HIV infections will continue to decline for at least a decade after 2030, with faster declines if global targets are met in all countries. Evidence from phylogenetic studies of HIV transmission patterns show that transmission in Eastern and Southern Africa is quite distinct, with diffuse transmission networks with small clusters, which is distinct from the large clusters we see in Europe and North America. Epidemiologic data also show that as infections decline, the proportion of transmission arising from groups with lower ART coverage and viral suppression, such as men, will be increasing.
Practically, what does it mean going forward?
So the stakeholder group convened by the UNAIDS really recommended that 4 key priorities to sustain HIV epidemic control beyond 2030 are, firstly, to sustain effective treatment for all people living with HIV, secondly, to ensure timely HIV diagnosis, with a shift from a focus on the proportion of people who are aware of their status to really reducing the time between infection and diagnosis. Third, we need to provide HIV prevention that adapts to the evolving needs of individuals and the preferences of people so that continued levels of prevention remain high. And fourthly, we need to maintain comprehensive HIV services for key populations for the long term, particularly because of the high rates of new infections in these groups compared to all other adults.
Thank you so much for your time, Olanrewaju.
Thank you.